Tom, and welcome to everyone who's joining us. I'm really excited to talk about female pelvic health with you this evening. Throughout the course of our webinar, I would really like to give you a broad understanding of what female pelvic health rehabilitation looks like. So we're going to go into the anatomy and physiology of the pelvic floor and its role in pelvic girdle stabilization. And then I'd like to introduce everyone to the most common presentations that we see in the pelvic health world associated with female pelvic health. We'll be talking about an external pelvic floor muscle examination that can be used if you are not an internally trained pelvic floor therapist. And I am going to introduce everyone to the internal assessment as well, acknowledging that if you wanted to learn more about that, we would recommend in-person coursework. But I would like to introduce everyone to it so you can identify if that's something you're interested in, if you don't already do it. And then finally, I'm excited to share with you some interventions that you can incorporate right away with any of your patients that might be experiencing some of the conditions we talk about this evening. As Tom mentioned,